Right. Thank you, Emma. So tonight, thank you everyone for joining. And so we're going to talk about how we can improve our patients' outcomes by using proactive vital signs monitoring. We'll also discuss about intermittent monitoring versus continuous monitoring. So our learning objectives are: why is monitoring important, which most of us know. We're just going to kind of go over that. The current methods we have for measuring vital signs, the technology. There's a lot of good technology on the market and how it's changing our game as far as being able to monitor our patients, and how continuous monitors can improve patient outcomes even more. And then evidence behind the technology and summary. So without further ado, so why is monitoring important? Well, obviously it's important because the earlier that we can recognize a problem with our patients, the earlier we can correct it. So it allows us to be proactive versus just reactive. And as we know, there are sudden changes in one or more vital signs can indicate something is wrong, such as infection, hemorrhage, shock, response to medication or treatment, whether that be an adverse effect or whether that be a good effect, the patient is improving, unforeseen complications, a pet not recovering as we expect, or even something as simple as the patient's comfort level. Are they too hot? Are they too cold, painful, anxious, things of that nature? And vital signs will change as these things change. So why is the recovery period a risk? So when I'm talking about the recovery period, I'm thinking the first 3 hours after an animal is either out of sedation or has been extubated after surgery. And so the reason that this is a really risky period of time is because of lack of monitoring is the main risk factor. And we see this in human as well as veterinary medicine. A lot of hospitals are understaffed and they're overburdened and things like that, as well as during anesthesia, maintenance anesthesia, while our procedure is going on, we're constantly monitoring the vitals. There's usually a specific anesthetic tech that's monitoring the patient every 1 to 5 minutes. They are, in addition, also usually we're monitoring blood pressure, SpO2, end tidal CO2, things of that nature. So the patient's being constantly monitored. But once the surgery is completed, a lot of times we get a false sense of security and we think, oh, risk is over, but we're very wrong. Research has shown us that of anesthetic related deaths, 47% in dogs and 60% of those in cats are post-operative period of anesthesia, and that most commonly those deaths are occurring in the first 3 hours. And so this shows us that even though we are done with our procedure and our patients are extubated, that there's still a lot of risk involved in those first 3 hours. So let's talk about, how do we measure temperature? Well, it could be digital or analog. We can use oral, which is, ear thermometers, rectal thermometers, or under the arm. Those are the three main ways that we see on a day-to-day basis that we're taking temperatures on pets. But there is no current method for obtaining a temperature on a veterinary patient that doesn't require touching or invading the patient in some way. As far as how we measure respiratory rate, you can do visual observation of the chest movement, obviously stethoscope, or while they're intubated, capnography. And we know that changes in respiratory rate are one of the best predictors of an adverse event, such as cardiac arrest. So having a precise respiratory rate is really important, and checking it frequently. Then, how do we measure pulse? Obviously, stethoscope manually, but this usually requires training of some kind to look for murmurs, drop beats, arrhythmias, things like that. Telemetry, EKGs, and pulse ox. Again, usually these are done while they're under sedation or anesthesia. Also the Doppler and palpation. But there's no current method for obtaining a pulse rate on a veterinary patient that doesn't require either us touching them or them being attached to a machine. And so some of the limitations of our current monitors is that they, like I have just said, they all have leads, pads, or attachments. So somehow they are touching our patients. They can fall off, they can tangle, as you get your cats or your dogs that spin in circles and they get tangled up, and potentially can injure themselves. We have to worry about our patients chewing on the wires, swallowing them. Potentially now we have a foreign body. A lot of those alligator clips are painful, and they irritate the skin, so they're not fear-free. And then these things need realignment. They get misplaced or lost, and several of them require shaving or glue of some kind. But all of these are invasive measurement methods that are used to get our monitoring on our patients. So What does AHA have to say? So in 2020, AHA put out vital signs monitoring guidelines. And what they talked about is that continuous monitoring, in specifically, enables prompt intervention in case of unforeseen complications and ensures the highest standard of patient safety. They went on to say that anesthesia, which is an integral part of daily care in veterinary hospitals, cannot be defined merely by the time that the patient is unconscious, but rather they define it as a continuum of care. And that continuum begins at home with the owners. If they're giving a sedative or anything like that, Gabatraz or anything before they bring the pet in, the entire time the pet is at the hospital, and then it ends when they return home to their owners. Monitoring, we know, decreases the odds of anesthetic death. So the more frequently we're monitoring our patients, we're going to decrease their anesthetic death rate. Whereas we've seen in research, lack of monitoring increases the odds of anesthetic death by a factor of 5. So the continually monitoring them is very important. And the other thing that AHA guidelines said is that we should continue monitoring specific patient physiological parameters such as heart rate, respiratory rate, SpO2, blood pressure, and body temperature. So now the American College of Veterinary Anesthesiologists, they originally had guidelines out back in 2009, and those recommended that patients be monitored by continuous monitoring devices along with intermittent methods. Now this year in 2025, just a couple of months ago, they updated those guidelines. And so in the immediate recovery period, so like we're talking about that first 3 hours that our patients are most at risk for anesthetic death, they say that this period from discontinuation of our anesthetic agents through extubation until the patient can maintain their own physiological stability, meaning they're maintaining their temperature without any heating devices on our part. They're maintaining their heart rate and respiratory rate as normal. They also say that recovery personnel should ensure patient safety through continued monitoring of physiological variables. So again, this idea of continuous monitoring. Things that they recommend that we be monitoring continuously during this period of time are circulation, ventilation, temperature, oxygenation, and pain. And for all levels of sedation, whether it just be, we're giving them dexdomitor and reversing it, or whether they're under general anesthesia, that we should have the pulse rate, capillary refill time, respiratory rate, and heart rate should be monitored all the time. And with moderate and deep sedation, those would require monitoring of the temperature in addition. So we see that it is really, really important that the more frequently that we are taking vital signs on our patients, we are significantly decreasing their risk of post-anesthesia death. So how can we do this? So there's a lot of technologies out there, and they are changing the game for us, and they're helping us to do our jobs. One would be artificial intelligence. And so artificial intelligence can be used to enable all kinds of different sensors to work together in devices, and it can help a technology called LiDAR by enhancing LiDAR's data analysis and motion detection. And I know you're thinking, what is LiDAR? Well, LiDAR is light detection and ranging. And what it is it's a technology that uses pulsed lasers to accurately and constantly measure distances to a given target. And so that target would be our veterinary patients. It is a light-based measurement, and it's most commonly used for motion detection, but it can be used for respiratory rate. Now, continuous wave Doppler radar is another technology, and I know we've all heard of Doppler radar when we're thinking about meteorology, okay? But continuous wave Doppler radar is a little bit different. It utilizes 2 transducers to continuously transmit and receive waves that interact with the moving target within the tissues. So that would be the lungs, the chest cavity, and the heart are things that we would be looking at how we would use this technology in veterinary medicine. Other technologies that are out there are infrared thermography, and that is obviously used for temperature detection and recording. The good thing about this technology, it is high temperature sensitive, which is very good for detecting fevers. The other thing there is an RGB camera, which is a red, green, blue camera. And so what that does is that takes that infrared thermography and puts it into an image, and enables us to actually see our patient according to these different wavelengths. And it allows us to have a real-time video feed that can monitor the patient 24/7. So these are some of the technologies that are out there. So let's dive into them a little bit more so we can understand a little bit more about what they are. So first, let's talk about the LiDAR technology. So LiDAR dates back to the 1960s, and it's very similar to either radar or sonar, but it's a lot more precise. And that's why it's really important to use, because obviously we want our vital signs to be, our measurements to be as precise as we can get them. It is a short range sensing technology. And what it can do is it can determine an object's optical characteristics, such as its reflectivity and absorption. And what it does is, instead of having our patient look like a blip on a screen, like you would see in a movie with a radar, like sonar on a submarine, it actually maps out visually what our patients look like. And so LiDAR works on the principle of time of flight. And so let's go through this kind of slow here. So basically, it's using a pulsed laser, and it's pulsing out a laser at, say, a dog. And what it's doing is it's measuring how long it takes for the light for that sense to come back to the point of origin. And so in doing that, you can determine how far away an object is. And so basically what you can do is you multiply the time that it took to come back by the speed of light, which is a known, and it will give you the distance in meters. And so that's how you can figure out how far away your patient is. That's how it measures the distance. The good thing about LiDAR technology is that it is not influenced by ambient temperature, lighting, or object texture and color, which is fantastic for us as veterinarians because our patients are all different colors and textures. And so what are some of the key advantages and disadvantages of LiDAR? Because just like with every technology, there's pros and cons to everything. And so some of the key advantages of LiDAR are that, like I had discussed, it's a high precision, it has unparalleled accuracy in spatial data. It also gives you 3D mapping of environments and body parts. You get real-time operation, enabling dynamic tracking of objects, like as the patient is moving in the kennel. And it's non-invasive, which is fantastic. Some of the disadvantages of LiDAR can be that if there's debris in the area, it can cause strong abnormal or spurious types of returns, such that sometimes the intended target that is not reliably detected. So sometimes there could be a lot of noise going on with it. Other things is that there's limitations on the available optical power that can be used. There is more power, but the more power equals more expensive. Obviously, in veterinary medicine, expense is something that we really pay attention to. The other is isolation and rejection of a signal from the emitted beam. So sometimes, it coming back, there can be problems with LiDAR. So evidence for LiDAR. So here, this was a study done on human patients. And what they did is they wanted to look at remote breathing monitoring using this LiDAR technology. And so what they did is they wanted to explore how LiDAR's capability was to monitor respiratory metrics in humans, but in different positions. Okay. So what they did is they tracked inhaling and exhaling patterns, estimating respiratory rate, assessing the depth of breathing, which is important. Are they taking big, deep breaths? Are they asthmatic? Are they agonal? Things of that nature. And detecting breathlessness episodes where they're either holding their breath or just not taking a breath. And what they did is they did all of that in 5 different scenarios. So they had the patients front facing the LiDAR, back facing the LiDAR. They had the LiDAR from the left side, from the right side, and supine, so when the patient was laying down. And what they concluded is that while subject orientation, meaning how the patient was lying down, affected the measurement accuracy, LiDAR still reliably monitored respiration across all of those situations. And this demonstrated LiDAR's adaptability for real-world use, where controlling a patient's positioning is challenging. Again, with veterinary medicine, we can't just make our patients sit still. And so next, we are going to talk about continuous wave Doppler. And so basically, a continuous wave Doppler radar always has a minimum of 2 transducers. One always transmits waves toward the patient, and one always receives the reflected waves from the patient. Okay. And then the Doppler shift is the difference between the frequency that was sent to the patient and into the tissues versus the frequency that is received back. And the transmitted wave interacts, like what we had talked about before, with the moving objects within the tissues, which would be the heart, lungs, the chest cavity. And the interesting thing is that the amplitude of the heartbeat signal is considerably smaller than compared to the thorax displacement that's caused by respiration. And so they use very complex signal processing algorithms to separate out these two frequencies. And then you can, by using the Doppler, the continuous wave Doppler radar, you can get a pulse rate and a respiratory rate. So it's pretty interesting stuff. And so again, as with all technologies, what are the key advantages and disadvantages? So the key advantages of the continuous wave Doppler are that it's always non-contact signal acquisition through fur or clothing. So through fur, but it could also be through clothing. It allows also non-contact monitoring with patients who are dangerous to staff or difficult to restrain. Because again, as veterinarians, we have to always worry about our staff's safety with the fractious patients and things, and as they're waking up from anesthesia. You also get vigilance and monitoring because it's continuous. And then it can also help you with stress and anxiety recognition. There's two key disadvantages. One is that it can be susceptible to chest vibrations that are unrelated to heartbeats. Another is that any movement causing displacement of the patient in the radar's field of view affects the measurement. So those would be the only two disadvantages of the continuous wave Doppler. So then let's look at some evidence for it. So basically they did, this was with human patients again, they did a high accuracy real-time monitoring of the heart rate and variability, okay, using a specific gigahertz continuous wave Doppler. They had 10 healthy human subjects. They were aged, 21 to, 32 or so. None of the patients had a history of cardiac or other chronic diseases. And the subjects were seated and breathing for 3 minutes. And then the Doppler was placed in front of the subjects at a distance of 75 centimeters. And what they concluded is that the proposed method for using the continuous wave Doppler radar is indeed capable for real-time applications and provides a small delay from the occurrence of the heartbeat until its detection. There's a high level of agreement between the BBIs extracted from the Doppler radar as signals and from the reference ECG signals. So there was a high level of agreement between what the Doppler radar came up with as well as the ECG that was being done at the same time. And the obtained results show that the proposed method outperforms all of the previously published methods considered herein that dealt with heart rate extraction in short time intervals. So that's evidence for using continuous wave Doppler radar for heart rates. So next, we're going to talk about infrared thermography. So we all know that the control of the body's core temperature is essential in maintaining an optimal body system functionality, okay, and the sensitive chemical and physical processes that occur within our bodies. And the skin temperature of a healthy animal under standardized environmental conditions stays within a defined reference range. Okay, we all know this. And it is dependent on blood circulation in the lower layers of the dermis. So therefore, any deviations in the surface temperature can indicate such things as infection, inflammation, and even in humans, they use it for malignancy. And this technology uses a thermal camera to measure subtle differences and changes in an animal's skin or eye temperatures. And it is fast, it's painless, it's non-contact, non-invasive, and radiation-free. And it's a method of photographically imaging temperature differences on the skin temperature. And so that is what that is. And then key advantages and disadvantages. So the key advantages of infrared thermography, number one, it's radiation-free. Number two, non-invasive and patient-friendly. So we're not, putting a thermometer in a pet's rectum, not sticking a thermometer in their ear. It's a lot more friendly for them, a lot less stressful, and it has an excellent safety profile. Let's see. So infrared thermography also improves the accuracy of temperature measurement because no stress reaction from the patient and the possibility are provided to discover the subtle changes in the surface temperature of the animals under different physiological conditions. Okay. And the emergence of infrared thermal imaging technology, due to its non-contact characteristics, stands out among many methods of body temperature measurement. And so, again, this is a good way for us to get a body temperature on our patients, particularly those who are, fractious, afraid, stressed, having, anxious type of patients. There are two disadvantages. One is that it is highly sensitive to heat patterns and environmental sensitivity, and there is a lack of standardization. And so as far as guidelines, there are veterinary guidelines for infrared thermography from the American Academy of Thermology. And so what they said is that the clinical application of infrared thermal may be instrumental in understanding the pathophysiology associated with veterinary disease and can lead to improved patient outcomes. They went on to say that vasomotor tone and capacitance play a significant role in thermoregulation, clinical symptomology, and manifestations of systemic illness. So temperature is very important in helping us with our patients. So that's a lot going on. And you think to yourself, okay, how is this all working together? Well, it can work together by a technology called sensor fusion. And what sensor fusion does is it combines the data from multiple sensors, like we've been talking about, to estimate the state of a dynamic system. And so again, more really complicated math, but they use a sensor fusion algorithm that integrates all of the outputs from these different sensors all together and gives you a very high accuracy and efficiency while consuming less power and reduced noise. And so your resulting estimate is more accurate, more reliable, more available, and safer for the patient and for the staff. So question is, how do these advanced technologies help our veterinary patients specifically? Well, number one, they give us because it's continuous, gives us real-time insights that foster proactive healthcare practices. Instead of being reactive to something bad that's happening, we can get on top of things a lot more quickly and be proactive. The other is monitoring for signs of distress, discomfort, or changes in a patient's condition. They're non-invasive, non-contact options for a continuous observation. And they reduce the likelihood of human error in measuring and recording vital signs, so you get increased accuracy. And also, it's increased convenience for our patients because it's less handling of them, which decreases their stress, and they're a lot more comfortable. So what are the differences in vital signs monitoring? There's intermittent versus continuous. So intermittent is the current standard of care in vital signs monitoring, meaning estimated about 15% of staff time is spent taking manual reads on patients' vitals. Okay. And typically, vital sign measurements are typically taken every 10 to 15 minutes. And each time that's taking approximately 5 to 10 minutes of our staff time. Okay. Intermittent monitoring also is time consuming, like I just said, and contributes significantly to work overload of the caregivers, which are our technicians. The collection of vital signs is irregular, often leading to missing early warning signs. If our techs get caught up, they're supposed to be taking these measurements every 10 to 15 minutes. We get an emergency that comes in, a different animal's, some things are happening. And so sometimes these get the collection of vital signs gets delayed, isn't as regular as we would like it to be. And also, you get the wake-up effect, which alters vital signs. You have an animal resting nicely in the cage, and then you go in and wake it up, and you're going to, put a thermometer in its rectum and, use a stethoscope to get its pulse. And now you've got this wake-up effect going on. So in the most critical recovery period, which is from when they're extubated to 3 hours post-op, your average patient is checked only 12 times. That's 120 minutes of the 180 that the vital signs are not being monitored. That's a lot. And like I said, that's when most of our anesthetic deaths are occurring. So now you have continuous monitoring. And what is this? Continuous monitoring uses some of those advanced technologies that we just discussed. Vital signs are recorded every few seconds. It reduces the risk of missing vital data and events because you're getting it every few minutes. It decreases the risk of contamination spread, especially in isolation wards. And it decreases the patient's stress. It improves patient's experience, it improves patient outcomes, and it's better for your staff. So what are some evidence for continuous non-invasive monitoring? Well, this was a study that was done in this was human, and it talked about the clinical impact of a multi-parameter continuous non-invasive monitoring in hospital wards. Okay. And so what they found is that there was a 39% decrease in risk of mortality with the continuous non-invasive monitoring versus intermittent monitoring. There was also a decreased transfer rate to the ICU. They had a reduced rapid response team activation and reduced length of hospital stay. So they concluded that the evidence of significant clinical benefit using continuous non-invasive monitoring was definitely shown. Some more evidence, again, this is a human study, is they did a trial of remote continuous versus intermittent monitoring after major surgeries, okay? And the protocol for a feasibility randomized control study. So what they found is that remote continuous monitoring systems have the potential to allow earlier detection of complications. They decreased the length of hospital stay for patients. They reduced morbidity and mortality in the patients, and there was an increase in rapid detection of adverse events, again, allowing the hospital staff to be proactive versus reactive. More evidence is that essential monitoring strategies to detect clinically significant drug-induced respiratory depression in the post-op period. Okay, and this came from the Anesthesia Patient Safety Foundation conference from 2011. And what they concluded is that the consensus of the conference attendees was that continual electronic monitoring should be utilized for inpatients receiving post-operative opioids. Spot checks were not adequate, as adverse events were typically preceded by instability that may not be detected by spot checks. And they further believed that continuous electronic monitoring with available and developing technology offers the opportunity for a prompt improvement in patient safety. Now, evidence in veterinary medicine. So this was a validation and method comparison for a zero-touch monitoring device. Basically, it was a white paper evaluating the accuracy of continuous non-invasive vital sign monitoring in dogs, and they were using the device called a Vet Guardian. And compared to a contact device with manual measurements, they used as the gold standard. And what the conclusion was is that the continuous non-invasive device showed similar, if not greater accuracy than the contact device, and consistent accuracy to manual vital sign measurements and other continuous monitors. So, what are the benefits to our veterinary patients with continuous vital sign monitoring? One, it improves patient monitoring. You're doing it more often. Number two, enables early detection of medical conditions and unforeseen complications. It improves patient safety, provides timely interventions, and we can identify any trends that are going to show that a patient is deteriorating. Overall, improves healthcare outcomes, meaning reduced hospital stays. They don't stay as long. Also, improved patient experience. They get personalized care and they're getting it faster. And also, evaluation of treatment efficacy. So with this, we can figure out the effectiveness of our treatments more quickly. It enables us to immediately alter treatment plans and medications. And so what continuous vital signs monitoring devices are used in veterinary medicine? Well, there are a plethora of continuous vital signs monitors that are in use in veterinary medicine. As discussed earlier, these all require touching the animal or having a device connected to the animal somehow. There's only one zero-touch continuous vital signs monitoring device for veterinary patients, and this is the Vet Guardian device. This device measures heart rate, respiratory rate, and temperature. The vital signs readings are continuous, and they are recorded every 5 minutes. And the sessions can be accessed by any smartphone, tablet, laptop, or computer. So that means if you are hospitalizing a patient overnight and you are at home watching a movie, you can check on your patient from there. You can access to any active session 24/7, and that includes overnight hospitalizations and your isolation wards. And so added benefits of the zero touch continuous monitoring. So not only is it continuous, but now it's zero touch, is that you have no wake up effect to alter your vital signs. You get decreased bite risk with fractious or anxious or stressed patients. You have decreased stress for your patients and your staff. You get decreased risk of human error, and you have increased staff efficiency. Your staff can be doing other things and not having to worry about having to go and check on the patient every 10 minutes. And so I have a video of the devices in action. And you can see they are connected to IV poles. and the animals are resting comfortably. But that is kind of what they look like. So in conclusion, temperature, pulse, and respiration are hallmarks of core body functioning, and abnormalities in any of these parameters can indicate changes in the patient's health status. Scientific research and veterinary anesthetic guidelines agree that continuous vital signs monitoring is beneficial for enabling prompt intervention in case of unforeseen complications and ensuring the highest standard of patient safety versus intermittent monitoring alone. Non-contact continuous vital signs monitoring has the added benefits of decreasing patient stress, decreasing injury risk for your staff, no wake-up effect, and increasing staff efficiency.